Hey everyone, welcome to the Exam Prep Explainer. If you're gearing up for your NSG 442 exam covering chapters 17 through 20, well, you've landed in exactly the right spot. I'm absolutely thrilled to be your guide today as we synthesize some seriously crucial information on population-centered healthcare interventions. We've got a lot of essential ground to cover to get you 100% ready for test day, so grab your notes, get focused, and okay, let's dive into this.
So, here's our roadmap for today. We're going to hit 4 core areas. Section 1 is building community partnerships. Section 2 is assessing community health. Section 3 covers the 7A factors. And Section 4 wraps up with principles of health education. All right, let's get your brain organized for this exam.
Starting right off with Section 1, Building Community Partnerships.
Now, before we can even think about assessing or educating a community, we've got to build trust, right? And honestly, before we even talk about community health, how do you actually define health? Is it literally just, not being sick? Well, for the exam, you need to rely on the World Health Organization's specific holistic definition. They state that health is a holistic state of complete physical, mental, and social well-being. It is definitely not merely the absence of disease or infirmity.
Now, what's really interesting about this slide is how this holistic definition from the World Health Organization literally drives all of our population-centered healthcare interventions. Public health nursing is all about the collective good. Our ultimate goal is for the community to achieve its maximum health potential. And to do that, it requires us to look at the whole socio-ecological model, meaning we have to consider the physical environment, the social services, the economy, really the whole shebang that impacts a population's well-being.
Let's translate that theory into a real-world scenario, the kind you'll definitely see on your test. We're looking at the academic/practice community partnership framework. Imagine step 1. Your nursing school, that's the academic side, wants to partner up with a local free clinic, the practice side. Step 2. To actually make this work, they form a Community Advisory Council, or CAC. That's basically just a board of local community members that helps guide the initiative. Step 3. They draft a Memorandum of Understanding, an MOU. Now, listen closely to this detail for the exam. An MOU is fiscally non-obligatory and legally non-binding. Actually, scratch that. Just say it with me so it sticks. Fiscally non-obligatory, legally non-binding. It's basically an agreement of cooperation, not a strict legal contract. Make sure you memorize those exact terms.
Moving right along to Section 2, Assessing Community Health.
So, we've got our partnerships formed, our MOUs are securely in place. But how do we actually figure out what the community needs? We have to assess the community as our client. And this brilliantly illustrates the different assessment frameworks you absolutely have to memorize. It's totally critical for exam success to distinguish between these models. First up is the WHO Healthy Cities Initiative, which takes a very broad, community-wide approach. Then there's CASPR. That is the CDC's go-to tool for public health emergency response. Next, we have MAP, Mobilizing for Action Through Planning and Partnerships, which focuses really heavily on building coalitions. And finally, the Community as Partner model. This one is deeply rooted in our nursing processes and emphasizes the dynamic, interconnected nature of community subsystems. You've got to know which model matches which focus, for sure.
All right, Section 3, the 7A factors.
Okay, you've picked your assessment model. Now we're zooming in on exactly how to evaluate the specific systems currently running in a community. I'm going to speed up the pace a bit here because this is pure high-yield memorization. When you're looking at community systems, like say a local health clinic or a grocery store, you have to evaluate them using these 7 A's. Ready? Awareness, access, availability, affordability, acceptability, appropriateness, and adequacy. Are the residents aware of the service? Can they actually access it? Is it affordable? Is it culturally acceptable? You need to have these 7 specific criteria locked down to properly evaluate any system.
Let's move to and see how this builds when we're actually out in the field. When you conduct what we call a windshield survey, which is literally just driving or walking through a neighborhood, you are actively assessing the place and the people. You're looking at the boundaries, the environment, the housing, the schools, the churches. And as you're taking all of this in, you're applying those 7 A's in real time. You're asking yourself, okay, I see a clinic here, but based on the public transportation routes I just drove past, is there actual access to it for the majority of the population?
And that brings us to Section 4, Principles of Health Education.
All right, so we've built partnerships, we've assessed the community using our models and the 7 A's. Now it is time to initiate healthy change. To really cement this, we're going to do a rapid-fire quiz. I want you to read this scenario and lock in your answer. Practice question 1. A patient successfully lists the risk factors for heart disease. Which learning domain is this? I'll give you a second. Do you have it?
Let's keep that energy high. Practice question 2. A community group expresses a newly formed belief that local water quality needs to be protected. What domain are we talking about here when a belief or an attitude shifts? Lock in your answer.
And here's the final quiz scenario. Practice question 3. A diabetic client demonstrates the correct physical technique for injecting their insulin. Now notice the physical action taking place here. What learning domain covers physical skills? Got your answer? Okay, let's see how you did.
All right, here are your answers. Listing risk factors is the cognitive domain, which is all about thinking. Forming new beliefs belongs to the affective domain, which is all about feeling. And injecting insulin is the psychomotor domain, because that requires acting. So the crucial point is this hierarchy of change. The absolute easiest thing to change is someone's knowledge. That's the cognitive domain. The next step up is changing their attitudes, the affective domain. And the most difficult thing to change by far is someone's behavior, the psychomotor domain. Definitely keep this hierarchy straight in your head for the exam. You know, there is a massive difference between simply educating and actual learning. We can throw a million facts at a community all day long, but learners are only going to accept information based on what they already know, what they already believe, and the culture they were raised in. As public health nurses, our educational programs absolutely must be tailored to these factors. Otherwise, true learning and behavioral change just aren't going to happen.
Wow, we have covered a massive amount of crucial ground today, right? From MOUs and assessment models all the way down to the cognitive, affective, and psychomotor domains of learning. So I want to leave you with this final thought. Now that you have these tools, how will you apply these partnerships, assessments, and educational domains to elevate the health of your future communities? Because at the end of the day, that's what this exam is truly preparing you for, making a real-world impact. Keep studying hard, trust your knowledge, and best of luck on your NSG 442 exam. You're going to do fantastic.